Hi guys, this is Vidya and I hope you're doing well. I'm so sorry that this is a late video, and thank you so much for all the questions you asked. Vikrant was a little sick, as some of you already know, and whenever he's sick he gives it to me. Finally we're both better, and hopefully this honey tea will help me get through this video. It is going to be a slightly long video. I'm going to chat with you guys a little bit. So if you're in a hurry to find answers to the questions you've asked, I will put some timestamps in the description box below. If you don't know what I'm talking about, head on over to the community tab of my channel. That's where I interact with you guys a lot, and you'll find a wonderful community of moms who communicate with each other and support each other. I'm so blessed to have this wonderful group of moms. I don't know what I did to attract this, but you guys are simply amazing. Somehow it's becoming a space where you can share something without the fear of being judged. And sometimes there's women who share the most, deepest personal things, and even before I get to reply to it, there's always a few other moms who reply and extend their support, a shoulder to cry on virtually. So it's a wonderful, wonderful place. So if you haven't joined this community, do go ahead and subscribe. So let's get to the questions now. The first question is from which week we should start eating 6 dates. And some of you also ask questions along those lines, and I get asked this quite frequently because in one of my videos related to natural delivery, I spoke about dates and their benefits for an easier labor. It was just something I came across during my pregnancy, and I thought I'll try it, and I think it worked for me. And many of you have written in and told me that it has worked for you guys, and you have had relatively shorter and easier labors than your sisters and your mothers. So it might have some truth to it. The research is for you to look through and make your own decision, but basically it says that you have 6 dates towards the end of your pregnancy, and it helps ease the labor. But then dates are also related to preterm labor, so I would say avoid dates until the very end of your pregnancy. So I started eating dates in my last month, like in my 9th month, 36, 37 weeks onwards. And I wouldn't eat all 6 dates at once. Sometimes I would eat 4, sometimes 6, They are very high in sugar though, so be mindful of that, especially if you have gestational diabetes, or if you have put on a lot of weight, and if your doctor has asked you to stay away from too much sugary foods. But if you are normal, if you're doing well, they are a great source of energy. They have amazing amounts of fiber. They are an all-round good snack. So if you're craving something sweet, go ahead and snack on a couple of dates, but in the last month of your pregnancy. The next question is about gestational diabetes. One of you wants to know if it's going to be problematic to have a normal delivery if you have gestational diabetes. Your doctors again will make the call, but I know of people who have normal deliveries with gestational diabetes. It is totally possible as long as you manage it well throughout your pregnancy. So make sure you're following the diet, and if it is out of hand, make sure you're taking whatever the medicines your doctor has prescribed to you regularly, and doing some sort of an exercise, provided your doctor says okay to that. Definitely possible, but sometimes the baby's weight is a little high and it becomes harder to have a natural birth. In that case, it's totally okay to have a C-section. Don't worry too much about it. As long as the baby is healthy and you have a relatively comfortable labor, you should be okay. Next, I have a couple of questions on the baby's weight being less when you're still pregnant. Like in the last stages of pregnancy, what can you do to increase the baby's weight? I guess when you do the ultrasound, your doctor would have given you an approximate weight of the baby, but it is approximate. It's not the exact thing. Like I know for a fact that what my doctor told me the weight of the baby was completely different from what it actually was when Vikrant was born. Only if the baby is not growing from week to week, only then you should be concerned. So make sure that you're having a healthy diet with some healthy fats, because towards the end of the pregnancy is when the baby puts on the fat tissue that will keep it warm when the baby is born. So have nuts, have things like avocados, have things like ghee, which are healthy sources of fat. Just because the baby's weight is low, don't go ahead and just binge on sugary stuff or junk food or oily stuff just for the sake of increasing the weight of the baby, because that affects the baby negatively for sure. And if there is any concern, first of all, ask your doctor if they are concerned about the size of the baby. And lots of babies are born small. Like Vikrant was a teeny tiny baby. He was barely 3 kilos when he was born, and he was completely fine. That's just the way he was. Next question is, I am 11 weeks pregnant and keep experiencing panic attacks. Do you think it has to do with hormones? I don't know about you personally, but for me, I definitely experienced mood swings in my first trimester, and I think it has to do with the hormones, because our body is still getting used to this big change that's happening, and it will take a few weeks to get settled in. I remember when I got into my second trimester, it completely disappeared and I was completely okay. So I think it has to do with hormones. Unless you are not able to function because of your anxiety and panic attacks, definitely just talk to your doctor, have a word with your doctor and see what's going on. But I think nausea also has to do something with it. We are not feeling the best because of nausea. We're not able to eat that well. So all of that adds up, leading to a bit of moodiness. But I definitely went through it. The next question is how to identify between Braxton Hicks and the actual labor contractions. When is the right time? Like which week do you start timing the contractions? I wondered a lot about this as well. So the best way is, this is what I heard from my doctor. When you think you're having a contraction and you want to know if it is for real, just get up and start walking around, like not running around. Just get up, change your position. Like if you're laying down, just sit up. If you're sitting down, just get up and take a few steps. If they're Braxton Hicks, the contraction usually disappears in a few minutes. And if it is real labor contractions, no matter what you do, they just keep coming and they keep getting stronger. So that is the best indicator. For me, with regards to how they feel like, for me, it was like Braxton Hicks was a pressure from the top of the belly, like all over the belly from the top. So it used to be like a pushing from the top. And then it would just fade away. It was not very uncomfortable. It was like a pressure. But real labor contractions, I felt it more in the pelvis, like in my lower back and my lower abdomen, kind of like a period cramp magnified 100 times. And they would be very intense. Like I could tell there's something happening right now. So they felt different, definitely. So everyone who goes through it tells you, you will know when you are in labor. And I was like, that does not help me at all. But it is true, you will know the difference. So if you are, concerned, just start timing whenever you feel like you're getting 2 or 3 contractions in, say in an hour. Just start the timer just to practice it, and see how far apart they are. And if they are getting closer, just give a call to your doctor. Maybe they'll do a scan to see if you're having real contractions. So next couple of questions are about exercise during pregnancy. Like one of you wants to know if it's okay to travel every day through bumpy roads. And somebody wants to know if it's okay to climb stairs 8 to 10 times a day. And somebody else wants to know if it is okay to stand for a long time during pregnancy. Again, I'm not a doctor, and especially I'm not your doctor, so I cannot tell you to do this or that. Sometimes you just wish like someone would just tell you what to do, right? I feel that way sometimes as well. Just tell me what to do. Tell me if I can do this or not. But it's never that simple. It always depends on what your situation is. So if you are in a healthy, normal pregnancy and you're gaining weight well, you don't have any other complications, then you can keep continuing your daily normal routine. Like I keep saying, pregnancy is not a disease. It is a part of your life, and your body was designed to do this. However, but sometimes you have complications, and you have like times during your pregnancy when you are a little more vulnerable to outside things. As a general guideline, it's good to be a little more careful in the first trimester because the pregnancy is still very early on and implantation might not have occurred fully, or for whatever medical reason. But it's good to be a little more cautious when it comes to doing strenuous activity like lifting heavy things or, you know, climbing up a lot of stairs. But as you get into your second trimester, your doctor would have done a scan to see if everything is going on well. After that, it's good to ease into a certain kind of exercise routine, or, you know, resume your normal daily activities. And I think pregnancy is a great time to start practicing how to listen to your body. Like, start tuning into your own body, because you will need that inner guidance even after the baby is born. There's going to be so many like decisions you will have to take that nobody else can take for you. So it's good to start you know, focusing inward and getting that kind of feedback from your own body. It sounds like vague, but it definitely helps when it comes to, like, you know, that mother's instinct that people talk about is developed gradually, and it's not 100%. Like, there's going to be times that we make mistakes, but I think it's good to have that kind of feedback from within, like some guidance from within. That will be very useful in our whole you know, parenting journey. Now, moving to newborn related questions, a lot of you have questions about breastfeeding, so I do encourage you to see my videos on breastfeeding and how to increase breast milk supply and those things. I get asked quite frequently, how much milk should a baby be drinking at a certain age? And this varies so much from baby to baby, and even for the same baby it varies from day to day, right? So it's very hard to kind of give your baby 50 ml of milk or 100 ml of milk at 2 months of age. It's not like that. So the best way to know if your baby is getting enough milk is tracking their weight gain. If they're gaining weight along a curve, so there are websites where they plot, where you get those graphs for babies. I'll put some links in the description box. They're basically growth charts. So once you plot your baby's length and weight, they'll tell you how much your baby weighs as opposed to other babies the same age, and you can track your baby's growth. So once you have that growth chart, like once you know that your baby is growing consistently, that means your baby is getting enough. If you're breastfeeding, I would say feed as per demand. So if your baby is asking to be fed, go ahead and feed them as many times as they want. There have been times when I used to feed my son every hour. There have been times when he used to sleep for a couple of hours, but they were very frequent. And especially if they're having a growth spurt or some kind of a sleep regression or some kind of a irritation, like if they're going through something, they will want to nurse more just for comfort sometimes. And make sure that you're burping them after every feed so that they're able to digest all that milk well. It will feel a little uncertain towards the beginning, but as your baby is getting older, their routine will get more established and they will take consistent amounts of milk or food at regular times. But until that stage is reached, it will be like in a state of flux. Like you won't know for sure if your baby is having enough or if you're producing enough. So just hang in there and keep feeding as and when the baby wants. Next question is, please provide some tips on how to maintain your sanity once the newborn arrives home, knowing that the first few weeks are going to be challenging. Believe me, nothing I can say or nothing you can prepare for will keep your sanity. It is going to be insane. You might have a completely laid back baby, but still is going to be a complete upside down of your normal schedule. Like this thing that, you know, this, not even a person, this new thing, a little bundle is going to take up all of your energy physically and mentally. And chances are that you're going to be drained, exhausted. You might have feelings of hormonal lows. So you'll go through all of that. Just remember that we all do, and we're all in this together. Like everyone goes through this. if nothing else, that will give you some kind of a consolation that everyone's experience is slightly different, but we all go through this and we come out of it. And when we do come out of it, we'll have nothing but pleasant memories of those times. Next, a couple of questions related to travel. Is it really necessary to carry diapers, one per each hour of flight? It is not. Chances are that you will not use all of those diapers, but I like to be on the safer side. Like Vikrant, because their schedule is interrupted, their bodies perform differently when they're traveling. Like, it is a big change for them. So Vikrant went through more diapers than usual on his first flight ever, and I was thankful to carry extra diapers. And I always account for layovers and flight delays and cancellations, whatever might happen. Like, there could be bad weather and the flight could be just stuck on the runway. So I like to carry lots of extra diapers in my carry-on just in case. But as your baby is getting older, you will know that they won't go through as many diapers. For a baby who is less than 6 months old, I would definitely carry many extra diapers. The next question is, I am traveling to India with my son who is 5 months old. When I'm in flight, how do I deal with baby's ears? So at that altitude, because of the air pressure difference, baby's ears get blocked and that gives them a lot of pain and discomfort. The best way to avoid that is to keep them swallowing. So if you're breastfeeding, if your child is just 5 months old, and if you're nursing your child, it's better to nurse them. Like, during takeoff and landing, anyway, you have to hold your baby in your lap, and that's the best time to get a nursing session in. Or if you're bottle feeding, give them a feed when you're just about to take off and when you're just about to land. And I would keep nursing until we have completely landed, or until we have completely reached a stable altitude. And if I keep doing that, if I keep making sure that he's swallowing something, it never caused a problem with his ears. And if you have an older child, have them sip some water or some juice or milk. And last couple of flights, I took a lollipop with me that Vikrant would kind of suck on when we were taking off and landing. So it was a special treat for him to help with that change as well. A lot of you want to know what I fed my baby when he was that young. So I do have a series of videos on feeding starting solids for babies, so do check those out. And some of you want to know what my baby eats in a day, if I could share a diet chart. I don't exactly know what a diet chart is. I've been taking short clips of what he's eating. So, but I didn't know if you guys will be interested. It's just like normal food that we eat, but I will share it with you since you guys asked. Another question on introducing solids is how do you, like, when do you introduce allergy causing foods like eggs, nuts, cow milk, etc. Cow milk I introduced after 1 year. Again, see my video on starting solids. There's a lot of information in that. As far as eggs and nuts go, there are studies now that say that introducing them slightly early on will help them from getting an allergy later on. Earlier they used to say avoid them as long as possible, but now they're saying introduce them in small quantities early on. So I would be very attentive when I'm giving him peanut butter or eggs or something, but we definitely introduced it before he turned 1 year. Eggs, I think we introduced at 10 months, and peanut butter also, like a few, like just a little bit on a piece of toast when he was able to chew bread. And I would introduce one food at a time, especially if it's something like nuts. So if I've given him peanut butter that day, the rest of the meals of that day would be something very simple that I know that are that don't cause him any kind of trouble. The next question is about iron deficiency in babies. He's looking very weak. Please tell us some iron-rich foods for babies. Once the baby is born, like once they are off your placenta, their iron levels drop, and they should have enough iron reserves for a few months, but their iron levels do drop in the initial few months. So if they drop a lot, then you will have to start supplementing with some kind of medicine, and your doctor will tell you that. If you're concerned that your baby is looking weak, definitely get a hemoglobin test done, and if the levels are too low, get a medicine. But in general, it's good to have lots of iron rich foods in babies when they're growing, once you've started solids, of course. And your baby, when your baby is eating well, like you haven't mentioned the age of your baby, but if your baby is eating things like spinach and lots of green vegetables, include those in your diet. Meat also has a lot of iron. Egg yolks have a lot of iron. Dates have iron too, so if you are giving them, like, if whenever I'm making oatmeal, I put lots of dates in the oatmeal instead of sugar. So wherever you use sugar, use things like jaggery or dates. Next are a couple of toddler related questions, like how do you deal with crankiness and tantrums of a baby, and how do you deal with when your toddler is being stubborn. I don't know how other people do it, but I think toddlers are not giving you a hard time. They are having a hard time. They are learning so much at this age. So on one hand, they are able to do more things. They're able to enjoy their environment more. And on the other hand, they're feeling powerless because not everything happens according to the way they want. So if we look at it from the toddler's point of view, they are not giving us a hard time. They are having a hard time. And that, if when you change that perspective, everything changes. Like the way you handle a tantrum changes. So when your child is just, going on an all-out tantrum because of something that triggered them, it's not because they're trying to push your buttons or trying to test your limits. It's because they are having a hard time coping with something that happened. So the best thing you can do is not lose your patience at that time and just be there for your child and help them through the tantrum, like help them through the new situation that they're going through. I think the hardest thing is for the parent to stay calm. Like I am the calmest person when I am well rested and if I'm having a normal day. But if I have had a couple of sleepless nights and if I am tired, then it's harder for me to deal with a tantrum than when I'm rested. So make sure that you're taking care of yourself, because you are the integral part of parenting, right? You are more important. Like your reaction is more important than your child's tantrum. That's the way I see it. And I think getting a child quiet is not the goal of or the solution of a tantrum. Like if you just threaten the child to hit him or something, the child will be quiet just out of fear. So they haven't solved the problem. They're just stopping expressing themselves. So we have to get behind it and support the child, while at the same time letting them express their emotions. One more thing I want to say is, when the child is having a tantrum, they are doing so because they're feeling safe to let their feelings out, right? You will notice that the child will have a tantrum when they are with you or when they are with someone close, like when they are with their parents. So that means they are finding it safe to let out their emotions with you. And if you stop them from doing that, if you say stop crying, they're just going to bottle them up, and it can get into their personality, of bottling up their emotions and not dealing with them, and you definitely don't want that, right? So you want to keep that space open, and it will be an inconvenience, especially if you're in a public place and everyone's looking at you, like you're not able to deal with your child's tantrum. But it's okay, this phase will pass and your child will come out stronger. And last, I've gotten a few questions about planning a second baby, like when is the right time, and if I am planning a second child, what do you think about having a second child? I feel single children grow up selfish and lonely, and career goals always don't allow for a second one. And one of you wants to know if my son is 14 months old and I want to plan for a second baby, is it too early? I don't know about selfish, but being an only child myself, I can tell you that I've always wondered what it would be like to have a sibling. Like when I was a child, I used to love being an only child because my parents, all of my parents' attention would be on me, and I completely enjoyed it. And as I am getting older, I would have loved to have someone to share my childhood memories with, someone, to have been in those same situations as me. I know relationships with siblings are not always perfect, and I'm blessed to have lots of very close friends and family that, support me no matter what. So ideally, I would like Vikrant to have that experience of sharing a childhood with a sibling, but we don't think about it right now because he keeps us completely busy for 24 hours, and two of us are, completely inundated with things to do around him. So it is not something we think about right now, but maybe someday in the future. And one of you wants to know how I stay organized as a mom. I am not the most organized mom ever. I try very hard. So those were the questions I have time to answer today. But if I haven't answered your question, I will go right now and reply to your comment. Thank you all so much for joining me on this video, and I'll see you another time. Until then, take care. Bye.